So how far out from surgery are you?
About 7 months.
And you were having pain in the lower portion of your spine, pelvis, buttock area.
Exactly.
And it was on the right-hand side.
Yes.
And it was really interfering with your life.
Very much so. Debilitating.
It hurt constantly?
Constantly.
Terrible pain.
Yeah.
And then you went through physical therapy, you went through medications, and you tried this and you tried that, and it...
Nothing worked. I tried everything possible, everything, short of surgery, and nothing worked.
And then, correct me if I'm wrong, but I believe that we did some injections.
Yes, several injections.
And we did the injections, and I put a needle into the sacroiliac joint. And the purpose of that was to give you some relief, but also diagnose the problem.
Exactly, yeah.
Okay. Well, let's show people what we did here. This is looking at the pelvis from the side, and you've had 3 screws placed across the sacroiliac joint, fusing that joint. This is what the sacroiliac joint looks like on the left side, and we have fused the sacroiliac joint on the right side by putting these 3 screws through there. They have threads on both sides so that it locks this joint together. It's hollow and it's packed with synthetic bone graft to get this to fuse together. So, since we've done that, what do you feel like now?
It's life-changing. I feel amazing. I'm able to do everything that I was able to do before. My quality of life has completely, turned around. I have zero pain, in that area. And I'm very, very grateful for everything that you've done,
well, thank you.
To get me back there.
Now we have to show that you've also had a hip replacement.
Yes, sir.
On the right-hand side.
Yes.
And you have some residual pain from that, but it's a different pain.
Right.
Completely different in location.
Right, totally different. Yeah.
So, well, thank you for letting me take care of you. I hope that...
Thank you.
My hope is that if people see this, they'll realize that if they have certain types of pain, there are solutions that are,
Most definitely, and it's worth it. I would recommend it to anyone, and definitely share my story with anyone who's thinking about doing something like that, because I think it is life-changing.
Well, your story is a little interesting too, because we submitted a pre-authorization request to your insurance company, and it was denied.
Yes.
As experimental and investigational.
Yes.
And we pursued it, or you pursued it, and you went through every level of appeal.
I did.
And we actually appealed it to the point where we said, your insurance company, and I'm not going to name it,
sure,
but we want a doctor not affiliated with this insurance company to look through the records and determine whether this is, in fact, what should be done. And we got it approved by going through a final appeal.
Yes.
On an outside surgeon.
Third party. Yes.
Third party surgeon who had no affiliation with your particular insurance company.
I exhausted all of my appeals with my insurance. It took over 3 years. But I went through everything, went through the third party, and they reviewed all of the documentation and said yes, that was the best course of action for my situation.
Well, good. And this is called a sacroiliac joint fusion.
Yes, sir.
All right, thank you.
Thank you so much.
Yeah.